Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Cik Noriah binti Othman from UiTM Pulau Pinang. The title of my presentation today is the effect of mindfulness-based stress reduction on anxiety and depression and HRQAL among cancer patients in Penang, Malaysia. Cancer diagnosis is a traumatic experience. If it is not addressed carefully, it can lead to anxiety and depression and can affect patient health-related quality of life, treatment compliance, and clinical outcome. Unfortunately, pharmacological treatment for the symptom have been related to significant side effects. So, as a result, the non-pharmacological therapies such as MBSR are required to reduce these adverse effects and improve patients' health-related quality of life. On the other hand, psycho-oncology is available in the clinical setting, but the number are very limited in Malaysia. So, on the other hand, the available oncology counselors furthermore lacks of the required tools and knowledge to deal with cancer patients. So, those non-invasive, cost-effective, and successful approach to patient is required. MBSR is a clinically effective method for the treatment of the various chronic diseases, including anxiety and depression in patients, particularly cancer patients. There were, however, disparities in anxiety and depression across patients with various socio-demographic, socio-economic, and illness characteristics. So, this study measured the impact of a 5 weeks of MBSR program on anxiety and depression and HRQOL on cancer patients in Penang, Malaysia, utilizing HADS and EORT-QLC 30 questionnaire as a study tool. If proven effective, this program can be utilized for the treatment modalities for psychological distress among cancer patients in Malaysia. So the objective of this study is to measure the level of anxiety and depression among cancer patients, to intervene the cancer patient with the 5 weeks of MBSR program, and to measure the effects of 5 weeks MBSR program on HADS, that is hospital anxiety and depression, and health-related quality of life on cancer patient, and to compare the pre and post MBSR program on anxiety and depression and health-related quality of life of cancer patient. So, this for the literature review, the MBSR program initially was an 8-week intervention which include mindfulness meditation, bodily awareness, yoga, and to study the pattern of behavior, thinking, feeling, and action in MBSR. MBSR is clinically proven method for treating various chronic diseases, including as on the slide. MBSR was brought to Malaysia by Dr. Pang Chenker, who adjusted the program to suit the Malaysian culture and spiritual health belief. Therefore, there is an eminent to study the effect of MBSR again in Malaysia because of the disparities of the level of anxiety and depression across patients with various socio-demographic, socio-economic, and illness characteristics as in Malaysian setting. MBSR was tested on a few group of healthcare practitioners like doctors, nurses, medical students, and it was proven effective. However, MBSR has yet never tested on cancer patients. This study was approved by the Joint Ethical Committee of the School of Pharmaceutical Sciences, USM, and Lam Wai Hospital on Clinical Studies in Malaysia. The study was conducted at Magna Activity Centres all over Penang. The sample utilized the purposive and theoretical sampling to recruit the patient. Inclusion criteria were patients at age of 18 and above, having any cancer of any type. We excluded patients on palliative and having mental disorders. The participants were randomly divided. The study designer, the participants were randomly divided into MBSR intervention group and the waitlist group. The MBSR intervention group were assigned for the 5 weeks of intervention, besides following the regular checkup. Patient on the waitlist group only follow the regular checkup. So the HADS and URT-QLC score were measured in both groups before the intervention. Results were then again taken after the 5 weeks intervention. So then the result were analyzed and then compared. So this is the table showing that the method MBSR intervention. We have the week 1, week 2, week 3, and week 5. And this include the exercise and also the lesson, the training lesson. And they have to do some home exercise where we monitor and remind through WhatsApp. And also we provide them a logbook where they have to mark whatever exercise that they do. There are some, this is some of the activities. So as the result, we managed to only recruit 22 participants in the MBSR intervention group and 16 participants in the waitlist group who were willing to join the program. The mean age were 48, which the majority of them were between 48 to 57 years old, and we had a maximum of 63. And most of them were the secondary school level of education and predominated by Malays and females. However, in general, there were no significant difference in the demographic and disease characteristic of the patient between the two groups. This is the table showing that the data where there is no difference. In terms of disease characteristic of the patient, out of all the disease characteristics measured as shown on the table, only 2 parameters show the difference. That is the therapies received by the two groups and the history of the side effect. Both have a different therapies received and different history of side effects. When we compare the between group mean comparison of pre and post MBSR intervention of HADS and quality of life of MBSR intervention group and waitlist group, we found out that there was a significant difference in the anxiety level between the waitlist group and the MBSR intervention group, where we found at those at the waitlist, those at the MBSR group have a significant reduction in the anxiety level, a significant reduction in the depression level. However, in the waitlist group, we found out there is a significant increment in the anxiety, in the depression. However, there were no difference in terms of EORT QLC. So, the post EORT QLC for both group significance, but it's reverse. The waitlist group has a better score compared to the MBSR group. So this we need further analysis on the item in the HRQLC itself, because the general measurement of EORT QLC cannot tell the overall HRQ quality of life of the patient. We need to go on the every single items in the out of 30 items. We need to see which item that contribute to the significance of the difference. As for the discussion, using HADS as a measurement method, we did not find any significant difference in the pre-value of the anxiety, depression between the intervention and waitlist group. That means we standardize the background level at the pre, there are no significant difference. But at the post level, there is a highly significant difference. It shows that MBSR is proven effective. And this finding that the 5-week MBSR intervention has a significant impact on anxiety, on depression, which is supported by a study by Zhang et al. 2015, where they also found the same result. MBSR also was the most common intervention study for anxiety and depression by Zhang et al. 2015. This remark back up the study finding that 5 weeks of intervention also is enough to help patients with anxiety and depression. In terms of quality of life, that is EORT QLC C30. The EORT QLC and cancer patient questionnaire is a standard questionnaire used for HR to measure the quality of life of the cancer patient. It includes of 30 items, functional skill, 3 symptom skills, and 1 global health status quality of life skill. Out of these skills, there are some parameters in the scale which consists of like symptom scale like dyspnea, appetite loss, sleepiness, constipation, and diarrhea, and financial effect also was asked, and there are negative and positive scores expected with each item needed individual assessment after the overall sum. So we discovered that MBSR has no impact on the overall HRQAL. However, some of the items in the HRQLC favors MBSR. This conclusion conflict with Bisling 2015, who observed an increase in all HRQLC item scores after 8 weeks of MBSR intervention. So we can explain because our patient are from different cancer phases, different cancer types, and different economical socio-economic background. So this is might like kind of giving a different result from what Bisling found. The statement by Bisling backed with our finding that our patient were diverse stages of cancer treatment, which could explain the mixed results. So the 5 weeks intervention of MBSR has reduced patient anxiety and depression and lessened the general psychological distress. That is our first conclusion. This finding of the research suggests that MBSR has a positive impact on cancer patient general health. However, as far as quality of life is concerned, we must take several circumstances into account on case-by-case basis in order to conclude the result of the quality of life of the patient after the MBSR intervention. So, as an overall conclusion, this research will contribute the creation of low-cost self-care psychological intervention protocol to help cancer patients improve their quality of life and establish economical illness management technique. So as a limitation, of course, we use a small sample size with various cancer stage, with various treatment varieties, and with various type of cancer, because it's very hard to get the uniformity of all this due to the we are dealing with a very vulnerable type of participant, which is cancer patient. We have very many obstacles to deal with. However, since we measure the pre and post experience of stress, the result can be used as a general guideline for cancer patient regardless of the lack of uniformity in the patient's background. So this finding can give a piece of inside information for further investigation. So, acknowledgement, I would like to thank UiTM for the support, and I would like to thank all my cancer patients who have participated in the study. I would like to thank Puan Azina Abdullah, who is the Makna representative of Northern Region, who have helped me a lot in introducing patient to me. With that note, thank you very much. Here are the reference. Thank you.